When your response to stress becomes clinically significant, we call that adjustment disorder. I'm Christy Bundakumara, psychiatric nurse practitioner with over 20 years of clinical experience and a lot of stress in my life over the last 15 years. And so I teach on how to be mentally strong. Right now I'm going through a series called Demystifying the DSM. The DSM is a book that we use for diagnosing conditions, mental health conditions. Adjustment disorder is where we are in the DSM, and it's in the trauma and stress chapter. I like using this diagnosis. We use it a lot in the military, and we use it a lot when there is no kind of major depression, anxiety disorder criteria being met. And we have previous videos on those diagnoses. Many of us we all experience sad mood. At some point in our life, we will have depressed mood. We all experience anxiety. We have another video on that, mild to moderate anxiety. These are normal experiences in life. So how do you determine if something is a disorder and whether you need help? Adjustment disorder doesn't always need professional help, but this is often the entry point of, kind of that preventative treatment and learning cognitive behavioral techniques, learning how to be on this mental health journey. We are all on a mental health journey. And as you listen to some of my videos, I talk a lot about this journey. We are all on a journey. Whether you are working towards self-improvement or not is a personal choice. But with adjustment disorder, this is when there is a known stressor, divorce, breakup, your child leaves for college, there's lots of stress in your life, maybe financial, relationship, or job. And you know what the stress is, right? So that's the first criteria of adjustment disorder, is that there is a known stressor. And there is a emotional behavioral response to that stress, okay? So we all have a response to our stress. We all should be learning new coping skills. As we mature, we should have additional coping skills as additional things come up for us in life. So the second criteria, or criteria B for adjustment disorder, is that there's some sort of clinically significant impairment and function. Either the distress that you are experiencing related to that stress is out of proportion to the stress, both culturally and kind of mentally, emotionally. So it's either out of proportion, or it's causing significant impairment and function. So when we talk about significant impairment and function, it's impacting your performance at work, it's impacting your relationships at home, it's impacting your sleep. Not all of the above, but one or more of those things is happening to meet the criteria for adjustment disorder. And the last three criteria, C, D, and E, have to do with there's no other mental health disorder. You're not experiencing major depression. You're not experiencing an anxiety disorder. There's not severe bereavement or normal bereavement going on. And these symptoms have lasted longer than 6 months. This is a great place to start when you go into counseling, or you make this decision to go into a mental health journey. Like, I need to learn how to take care of myself. I need to learn new coping skills. And so adjustment disorder, I use it often in 3 places. 1, children coming in, and there's some marked emotional behavioral problem. Even if I suspect a major depression or disruptive mood disorder, it's best to start with adjustment disorder. Get some counseling in place, right? If counseling alone is taking care of the problem, then it's adjustment disorder. It's not some of the other mental health disorders. Many of those mental health disorders need more intensive care, often need some sort of intervention medically. And so adjustment disorder, I like to have that as my initial for children coming in. Now, it's important for parents and anyone to know that if you are coming in or going into a counseling center or a psychiatric evaluation, in order for us to bill insurance, we have to have a DSM diagnosis. And so, even if you're like, well, I don't want a diagnosis, adjustment disorder is great because it is a short-term diagnosis. It will not follow you long-term. We use it often in the military, right? We have young soldiers, sailors coming in. They are not adjusting to the military culture. And so they are given a diagnosis of adjustment disorder, given the counseling that they need, and being allowed to separate from the military. This is an appropriate response to an adjustment disorder. And so these are the things that, and you can have symptoms. So some of the modifiers on this are, adjustment disorder with depression, adjustment disorder with anxiety, adjustment disorder with mixed presentation, with conduct presentation, emotional conduct presentation, and of course we can always say unspecified. This is a very good way to allow people to gently come in to the mental health professional space, get the treatment that they need, get the counseling that they need without, the fear of this long-term diagnosis like major depressive disorder or disruptive mood disorder. And it allows for that safe space. So we use it a lot in that context. But remember, per the DSM, this is a short-term thing, about 6 months, and it's an inappropriate or disproportionate response to a stressor. Okay? And it's okay. We don't all have the right coping skills to handle what's going on in our life. So if you are experiencing these symptoms of depression, conduct, mood, or your child is experiencing these symptoms, let's get an evaluation. Let's start teaching them the coping skills, the skills of cognitive behavioral processing in our brain. And I often talk about, we teach the Mentally Strong method. But mental strength is that ability to think through your problems, organize them, and make choices in line with what you want, right? So if you are not doing that successfully under the current stressors, it doesn't mean you have some major mental health condition or long-term mental health condition. Maybe you just need some help, some coaching, some counseling, some recommendations and advice. And so come and get that, or find a place to get that. And this again is a short-term problem, and it's just a disproportionate response to stress. So demystifying the DSM, adjustment disorder. Come and join me on a mentally strong journey, because I believe that you are mentally strong. If you got to the end of the video, you obviously enjoyed some of the content. I have a lot of free content out there. I am really trying to empower everyone to find their mental strength. So subscribe, get the actual notifications, and let's embrace this journey of mental strength. See you there.